Hello, everyone. Welcome to this Lancet webinar on child and adolescent health and how that interacts with digital spaces. We are presenting this in partnership with UNICEF and Young Experts, Tech for Health. My name is Liam Messin. I'm the Deputy Editor for the Lancet Global Health, and I'll be one of the co-chairs for this webinar. Now, 2023 has been a particularly important year for the Lancet, which was launched 200 years ago in 1823. And to mark this 200th anniversary, the whole of the Lancet Group, all the journals, all our editors, associate editors, external board members, communications, marketing, digital and audio, you name it, have throughout 2023 been focusing on 5 particularly important healthcare topics, which we refer to as spotlights. These spotlights are universal healthcare coverage, health and climate change, research for health, mental health, and today's spotlight, child and adolescent health. This is the second webinar we've put on for the spotlight on child and adolescent health, following on from a previous one in February of this year, which looked at the interaction between climate change and child and adolescent health. And over the next hour and 15 minutes, we're going to explore the effects that digital spaces can have on children and young people, in particular the impact they can have on their health and well-being, why inclusivity within these spaces is important, not only for health and well-being, but for young people, and how some of the ways in which this inclusivity can potentially be achieved. Now, we will first have some opening remarks from my co-chair, who I'll introduce in a moment, followed by a panel discussion, and then a Q&A session where you'll have an opportunity to speak, and finally, time permitting, I'll have some closing remarks. I thought I'd just go through a little bit of housekeeping before I get to my co-chair. You're welcome to submit questions throughout the webinar by using the Ask a Question box, and we'll be keeping track of these throughout. On the dashboard, you'll also see a box with related Lancet 200 resources and a link to our spotlight, Child and Adolescent Health. And this will show you additional content hosted on thelancet.com. You can adjust and minimize any of these boxes on the dashboard to suit your preferences. This webinar will be recorded. You'll all be provided a link to the on-demand version via email, and you're also free to join the conversation on social media using hashtag Lancet200. So allow me just to quickly introduce my co-chair, Danielle Mullings, who will be giving the introductory statements. Danielle's worked with the Lancet before. She was our regional youth champion for Governing Health Futures, a commission between the Lancet and the Financial Times. She graduated from the University of West Indies and has just started a master's in translational health sciences at the University of Oxford. I'll now hand over to Danielle, and she can please give us an overview of the intersection between digital health spaces and child and adolescent health. Danielle, take it away.
Thank you so much for that introduction, Liam. I am honored to be co-chairing with you today, especially as a young woman from the vibrant island of Jamaica. Today, we're embarking on a critical conversation, one that really strikes at the very heart of our future, with this Lancet Spotlight focused on closing the digital divide for children and adolescents. Now, as a young person, I've witnessed firsthand the transformative and sometimes destructive power of digital spaces. And that being said, I firmly believe that every child and adolescent should have equal access to both the opportunities of digital spaces and to the mechanisms of protection from its harmful areas. Digital spaces, as we know, are far more than just scrolling on social media and idly browsing websites all day. They are our gateways to information, education, employment, and the social connections that really shape our lives. Access to the internet has now become a social determinant of many aspects of our lives, as impactful as the country you were born in or the school that you attend. Our health, our education, and our future are intertwined with our access to these digital resources. So, it's interesting because when we think about young people, we tend to view them as this homogenous group of digital natives. But if we really face this stark reality, not all young people have the same opportunities or resources. And this inequality to access and benefit from digital spaces, that's what we term as the digital divide. Now, according to a 2020 joint report from UNICEF and the International Telecommunication Union, ITU, 2/3 of the world's school-aged children, which is about 1.3 billion children aged 3 to 17 years old, do not have internet connection in their homes. Now, this divide excludes a significant section of our youth and can be compounded by adjacent issues such as low digital literacy, exclusion of those with additional needs, for example, those with visual or hearing impairments, online harassment, or the lack of technological infrastructure in some regions. So I view digital literacy and online safety as equally as important as access to technological infrastructure. So we have many of these different barriers that hold us young people from realizing our full potential, as well as our ability to access the resources that we need. But what's truly concerning is that the divide also has health consequences. Imagine not having the internet to research your health concerns, or not being able to communicate with your doctor who lives miles away when transport isn't easy to come by, or not being able to access mental health services remotely, or not being able to attend virtual classes and lessons during the pandemic. These are not hypothetical situations. These are harsh realities for many young people. And so for children and adolescents, limited access to digital tools means limited access to healthcare information, educational resources, and even mental health support. So in Jamaica, where I come from, I've witnessed how the digital divide affected my peers, especially during the pandemic, where restriction meant individual movement was severely limited and students no longer had as much independent physical access to health services. So you start to now depend more on remote services, which if you don't have access to the internet, you can't utilize that. I've seen initiatives that provide a space for young people to interact 24/7 with volunteer counselors, such as UNICEF Jamaica's You Matter mental health chat line. And that platform has been made free for all users to access by both major telecom providers in Jamaica, which really underscores the importance of public-private partnerships to bridge the digital divide. And I had the pleasure of helping to form these partnerships with our telecom agencies as the project manager for another U-Report project here in Jamaica called Fundu, which provides digital life coach. It is a digital life coach teaching youth vital life skills. So overall, we're not powerless in this face, in the face of this challenge of access to digital resources. It's a collective responsibility. Governments, organizations, and individuals, we all come together and each of us has a role to play. Now, we must advocate for policies that bridge the digital divide and ensure that no child or adolescent is left behind. We must support initiatives that provide digital access to those who have been left out, especially marginalized youth. And in closing, I want to emphasize that the conversation we're about to have today, it's not just a discussion, it's a call to action. And the insights that we gain today, the solutions we explore, all of this will shape the future of child and adolescent health in our digital age. So I'm thrilled to be a part of this panel discussion, and I look forward to the valuable contributions from our esteemed panelists and audience members alike. So back over to you, Liam, to introduce our speakers for today, our panelists.
Thank you very much. And I'll just get into introducing those speakers. First up, we have Joanna Lai, a health specialist from UNICEF, one of our partners, and based at their headquarters in New York. At UNICEF, she serves as the health section technical focal point for school, adolescent, and mental health. She's a public health practitioner with a background in planning, delivery, and evaluation of health and counselling services for children and adolescents through schools, community platforms, and within clinical settings. We're also joined by Shalani Palahawandana, a member of the Secretariat at Young Expert Tech for Health, our other partner. As a sexual and reproductive health and rights peer educator, Shalani works with different vulnerable and marginalized communities, including youth groups, to build their capacities for education about sexual health and access to resources and intervention as required. She was also part of the Technical Advisory Committee on Adolescent and Youth Health of the Family Health Bureau of Sri Lanka. She's a lawyer by profession and she practices public law in Sri Lanka. Next, we have Sherry Pagoto, a licensed clinical psychologist and professor in the Department of Allied Health Sciences at the University of Connecticut. She's also director of the University of Connecticut Center for Health and Social Media and past president of the Society of Behavioral Medicine. She's also a member of the Lancet Digital Health International Advisory Board. Her research focuses on leveraging mobile technology and social media in the development and delivery of behavioral interventions for cardiovascular disease prevention. Fourth, we have Eliza Torres, a high school student from Chile. She is founder and CEO of Girls in Quantum, a non-profit organization where she seeks to democratize quantum computing education to students by creating a community of enthusiasts and providing free and interactive content through the organization's website. With her team of international ambassadors, Girls in Quantum have impacted thousands of students from over 21 countries. Our final panelist is Manisha Pathak-Shalat, Professor of Communication and Digital Platforms and Strategies at MICA. Ahmedabad, India, and editor for the Journal of Creative Communications. My apologies. She has a PhD in Mass Communications with a minor in Gender and Women's Studies from the University of Wisconsin-Madison, USA, and a PhD in Education from Maharaja Saryajero University of Baroda, India. Manisha's research interests are communications for social change, health communication, digital cultures, and inclusive design. As you can see, it's a very, very well-established board with very extensive CVs. But I think it'd be good, we're bang on time at 3:10, to get to know our panel a little bit better. So I'm going to start the panel discussion now with the first question to everyone. As we heard from Danielle, digital spaces have the opportunity to improve and impair the health of young people and adolescents. And Danielle's final point about the importance of inclusivity is particularly pertinent, since digital spaces can only have, whatever positive effect they might have if everyone can engage in equally. So I'd like to begin by asking all of our panelists to speak about their concerns for digital inclusion and any groups they think are particularly at risk of being excluded. We'll start with Manisha.
Thanks, Liam. See, the world is highly impacted by digitization and globalization today, and none of us can escape this reality. So I'm concerned about digital inclusion because full public participation and personal well-being are severely compromised if, we don't have digital access. Of course, we have to remember that digital inclusion does not mean only access. We need the skill, we need the opportunities, we need the digital literacy, and that is actually digital inclusion. The access and digital participation also mean that there will be risk. And we have actually very little in place, where we can help our young people to actually counter the risk they face online. So that is also part of digital inclusion and my concern. But my biggest concern is the dominant narrative that we have built about the youth from underprivileged backgrounds. It could be youth from the global south, it could be youth from low-income countries or any other underprivileged background. Because our tendency is, to see these groups as people with no agency. We see these young people either as just cheap market, a lucrative market, or cheap labor, or criminals, who thrive on piracy and hacking, or at the most, as targets for development experiments. But we don't see these groups as legitimate participants with agency, who negotiate this digital and global world. So that is one of my concerns. When you ask me about who are the most excluded groups, I would say that young people from rural and tribal areas, who are remotely placed, also girls from low-income families and highly patriarchal cultures, and even elderly women. These are often excluded from participation. The other thing is, when we think about childhood and adolescence, our tendency is to see this as a carefree, fun, rebellious time. And when we design programs or spaces, this is the perception we have in mind. And we completely forget that there are millions of children and young people in the world who don't have this beautiful reality, So these are the children who are either institutionalized or come from very poor backgrounds, or say are living in refugee conditions or in conflict and war zones. So there are so many of these children who do not have this ideal reality of childhood and adolescence. And I think when we think of digital inclusion, these are the young people that we have to constantly keep in focus and remember that we don't exclude them. Thank you.
Cool. Thank you very much, Manisha, for that great overview. I wondered, Joanna, if we could turn to you now. I mean, with UNICEF, you probably have the most kind of bird's eye look at this problem. Maybe you could, provide us some of the stats and figures that UNICEF have on this problem.
Definitely. I think Danielle has already briefly mentioned that UNICEF and the ITU reported on child and youth internet access at home in 2020. And from household surveys, just building upon what she already mentioned about 2/3 not being able to access internet at home, household survey data from that report shows us really that there are significant inequalities across countries, across regions, across wealth groups, rural, urban settings. For example, West and Central Africa, only 5% of children and young people have internet access at home. And that's compared to the global average, which is about 33%, or that only 6% of children and young people in low-income countries have internet access as compared to 87% of this population age group in high-income countries. So the concern being that we know increasingly digital space is such an important and central way for people, especially young people, to access essential knowledge, information, and services that influence their health and well-being, that this becomes a critical point. And also, as Danielle mentioned, that beyond digital connectivity, there are other issues to consider when it comes to inclusion as it relates to use. Digital literacy, the cost of data, language and cultural sensitivity of the content and the apps and the sites that we developed, accessibility features Danielle had also mentioned of these platforms. You might have internet availability where you are, but that won't be enough if you don't have data or a device or an environment where you can use it comfortably, or if you don't know how to navigate certain apps or sites. So these are all really important things to think about, and that we still have a ways to go in terms of making access more equitable.
Thank you very much. I mean, if we've touched on a bit with some of our answers here about the possible exclusion, that young girls face. And I think, Eliza, it'd probably be a very, very good time, not just because you are an adolescent, but I think it might be a good time for you to talk about the exclusion perhaps that young women face online.
Yeah, for sure. So definitely, I think that at Girls in Quantum, we've seen and we've been working with a lot of girls right now, especially to sort of close the gender gap in sciences or STEM areas. So science, technology, engineering, mathematics. And I think that one thing that worries me the most is how they can access these educational resources. As other speakers were telling before, this problem in inequalities is very concerning right now. So how would girls would be able to learn if they don't have the right internet connection, for example, or they are not really connected to other areas or perhaps other platforms that would allow them to learn. So I think that right now we're trying to focus that on Girls in Quantum, especially to see how we can interact with them, how we can start getting other people in their own regions, especially because many girls are from rural areas or remote areas where internet connection is almost impossible right there. So we really want to address that. And I think that's a really concerning problem, especially as we're students teaching each other about different technologies, especially education in sort of quantum computing as well. So it's something that we need to work on, but definitely also a concern from all of us at the team that we want to address, hopefully through this community that we have. So I think that right now inequality is a big problem for us, in especially in girls and females. It's something that we need to start thinking in a group. More collaborative efforts are the best right now, and yeah, it's my concern. So I hope that Girls in Quantum could also sort of go and work for that, towards that.
Cool. Thank you very much, and we'll definitely have time later to dig a bit more detail on precisely what you're doing with Girls at Quantum. Right. Yeah, Sherry, would you like to take this question next? Because this, of course, isn't only limited to young girls, these concerns of exclusion. Sherry?
Absolutely, thanks. So a group that I would say I have concerns about in terms of inclusion would be LGBTQ youth. There's actually some emerging research that's showing that LGBTQ youth benefit from private, inclusive online spaces. And so that's very encouraging, but I think we need to be doing more as public health professionals to think about ways that we can create these spaces that could be free of stigma and bullying, that aren't geographically limited. We know that there are areas around the world where homosexuality, the legal landscape is not welcoming, and that there's a lot of concern about for example, it's illegal in a number of countries, homosexuality, and And so the freedom to be able to speak about health-related issues, their gender identities, and sexual orientation can be quite limited. And we know that there is a lot of stigma around this worldwide. So I guess what I think would be important is if we could think more about how we could proactively create online spaces that are co-designed with these target populations so that we can make sure that they're meeting their needs, partner with groups that are already doing this type of work, and in general, really any groups that have been the target of stigma and bullying online. I think there is a potential for us to be more proactive about creating online spaces. So that's sort of what I'm thinking about a lot in my research, and there is a lot of promising data to show that this can really improve mental health and other types of health outcomes. But I just think we have to be purposeful and mindful and partner with communities to think about how to best create these spaces.
Yes, definitely. And I think that brings us very nicely to our final panelist, Shalani. You are a youth-led organization that partners with youth around the world with young experts in health. So, what groups are you focused on, either personally or young experts in health in general?
I think the panelists before me actually address specific communities and groups of young people and adolescents that need to have the spotlight on actually. But I would like to bring up the issue of people living with disability, specifically young people living with disability, and even in that, the deaf youth. Young people with hearing disabilities, deaf or hard of hearing. So if you really think about it, like I want all of you to just think how many deaf people, how many deaf youth or adolescents have we seen in international or national platforms expressing their ideas? Have we come across anyone who's deaf? Do we see them on television or mainstream media? So the obvious answer is no, right? So they are a particularly marginalized group, even within the broader definition of people living with disabilities. And digital spaces, digital health, and digital technologies can actually have the potential and have proven to actually effectively bridge the communication gap between the deaf community and the wider world. So the fact that the use of the videos, the pictorials with the captions, and these practical small details that the digital technology brings in can improve the communication and the access to knowledge and information by a big margin. So that's something I think we need to think about. And when we talk about inclusivity and improving access and how digital technologies can contribute to that. So apart from that, I think the panelists before me spoke about it also in young people in different contexts, conflict settings, different marginalized communities, people who are structurally excluded in other ways than it could be descent, it could be their identity. So digital platforms can, by and large, include all of these young people and have the potential to do so. But it's also important to recognize and acknowledge that coming from my region, I know digital health and digital technologies the uptake has been quite slow, even though there's a lot of potential for improvement in inclusivity.
Thank you very much. And I think we will have potential for improvement. We'll hopefully focus on a great deal throughout this talk. Danielle, I believe you have the next question.
Yes, so, I think we've all been touching on this idea of mental health a bit. So perhaps, Joanna, you could talk a bit more about the mental health impacts that can really befall excluded groups.
Thank you, Danielle, definitely. So as part of the UNICEF State of the World's Children report on mental health, one of the things we did was also conduct focus group discussions in 13 countries with over 1,000 10 to 19-year-olds around their experiences and their perceptions on the topic. And I think this really helped us to gain a better understanding as well. And just hearing about their thoughts on social media, digital connectivity, and mental health. From what we heard, social media and internet were really, I think, as all of you have already mentioned, central to their lives, particularly in middle and high income countries, where on and offline experiences were really interwoven kind of into the daily realities of most of the young people's lives. And though not as central, it still definitely had an impact on young people in low income settings as well. And some of the things we heard them talk about, the toxic, in their words, toxic impact of social media, particularly on their self-esteem, feeling a strong need for validation online through different social media platforms. There was also a strong sense of self-acknowledgement from them and recognition among themselves about the difficulties that they had with self-control and getting, in their words, getting stuck on digital platforms. They also expressed fears and worries about online violence, bullying, harassment. And while these were some of the main concerns and harms that they had pointed out, they also recognized the benefits. Some of the benefits they mentioned were being able to be exposed to new ideas and friends, being able to maintain social support. They also felt the ability to share their feelings or get information and support anonymously was a very powerful thing for them. As you mentioned also with the You Mattered line in Jamaica, that's kind of part of that. And so the impact of digital technology on mental health, I think, as all of us experience firsthand, it's a nuanced issue with both harms and benefits depending on what platforms are used, for how long, and how often it's being used, the type of content we're exposed to, the reactions of other people online to us, and also the kind of offline environment and relationships we have. And because of all of these range of factors, mitigating those risks and responding to these needs is an ongoing effort that's going to require collaboration among parents, educators, young people themselves, tech creators, and policymakers to really think through how to mitigate some of these risks.
Thank you so much. Back over to you, Liam, for the next question.
Yes, and thank you to both you and Joanna for really establishing, the health impact. This is still a Lancet webinar, still very much interested in health and the importance of this spirit of inclusion. So then I think the next natural question is, what can be actually done, to foster this spirit of inclusion? Or better yet, perhaps start one de novo. So I'd like to come to you now, Eliza. If you could really just take us through, because I think you're the only person on the call to have done this, your kind of first-hand experience setting up this group, this inclusive, education environment, Girls in Quantum. What prompted you to do so, and how did you go about it?
For sure. So I actually had the great opportunity to have a scholarship for a program that let me learn about quantum computing and other areas in technology. And I was so happy about it. I actually noticed this whole community behind there, but how we were all connected through internet, how we were all learning together. We were connected by a same purpose right there. And I think that led me to found my organization. In my case, we're a youth-led organization, and we provide free educational resources through internet, through platforms, online platforms for students, so they can learn anytime, anywhere about quantum computing. But actually, what we've noticed is that, of course, there are certain problems in terms of connectivity, how students can access right now to their educational platforms or educational resources we have if they are good connected to internet right now. So one of our other main issues is how we have been addressed not just the socioeconomic issue right there, but also linguistic area. So how students they do not only speak, or they do not speak English, but they speak Spanish, or they speak other languages. So I actually had the great opportunity to meet Rohini, which is our ambassador of India right now. And she suggested, well, what if we start translating some content here to my region, to the south of India? They speak a lot of Tamil, for example. So we started translating some content to Tamil. And that's how we started translating also to Spanish and other languages. I think that has been a great change. Sometimes we've been asked, hey, how do you translate everything? But actually, one post may take us 10 minutes more if we translate it to other language. But that can make a real change to other people so they can start learning. I think that we've learned so far that it's great how we can start thinking in a group about different ideas of bridging those gaps. We know that right now, girls, especially in low-income countries, are the most affected ones in terms of internet accessibility, in terms of languages, how they access those materials, if not having the language, but also the internet connection. So at Girls in Quantum, we really try to bridge that. And I think that it's been great to work with other people, to start translating content and also learning with each other.
Cool. Thank you very much for that example, Eliza. Now, that of course is a very specific example. So, Manisha, this is your area of research. I wonder if you could speak a bit more generally about this problem. What can online communities, in general, be doing to become more inclusive, and what benefits do we see when they are?
So I certainly believe that online communities can foster the spirit of inclusion because they fulfill the basic human need to belong, and which is very important for well-being. And you'll observe that there is a wide range of these communities. So, there are interest-based communities, there are issue-based communities, there are identity-based communities. For example, these communities can evolve around gaming or fandom or hobbies. And they can also evolve around, say, gender identities, especially marginalized gender identities or other marginalized identities. Or, they can be based on consumer identities, like people believing in, say, fair trade shopping or green consumption, or civic identities, when you identify, say, as a climate activist or as a peace builder. So there is a wide choice, for young people to be included, based on what their needs are. But what is really important that we found that all of these communities, especially when they are moderated by sensitive adults or by youth themselves, these communities feel young people feel validated. They feel them accepted and heard. And this is a very important thing for well-being. Also, when done well, these spaces can also become very important spaces for learning, because here you can learn democratic skills, you can learn how to engage in dialogue with people whom you consider different. You can actually learn, what does it mean in practice to be inclusive or to respect diversity and equity. So good online spaces can be excellent learning spaces. And these communities are especially important, for those youth who don't have that kind of support in their offline social circles, or let's say in their geographic proximity. So for this kind of youth, they are all the more important. But the only thing I think we need to remember is that not all online communities are like that. So it is quite common to find hate speech on online communities. It is very common to find abuse and vicious trolling on some of the online communities. So we have to remember that not all online communities are this kind of inclusive. They can be very discriminatory and abusive. And so digital literacy is very important for young people to decide, which kind of communities they should be part of. Thank you.
So both of these examples that Manisha and Eliza have given are examples from the community themselves. But there's a layer that's behind that. We're looking at the developers, those that create the digital architecture used by communities. So Shalani, to begin with you, what can developers be doing to help address the needs of youth with, for instance, a hearing impairment?
Yeah, thank you, Daniel. So I think I'll share my experience and how we develop a digital solution to improve access. So the first principle is that it has to be community central to, and it has to be done in partnership with those who are those whose issues that we're trying to address for. So our approach was to have the deaf community actively involved in the making of whatever the solutions, whatever the solution or the technique or anything knowledge product that we create. So one thing that we so I'm from Sri Lanka, so one thing that when we initially did our baseline work, we realized is that the sign language in Sri Lanka did not have any terminology at all to address sexual and reproductive health and rights in any sense. For example, they were using the same sign to indicate sexual intercourse as well as rape. So imagine what kind of a confusion that would create in any given circumstance. So any healthcare service provider, or even law enforcement authorities would not know sign language to begin with. But if you have the same sign to indicate two vastly different things, with I don't think I'll have to tell you the implications of having the same sign to indicate rape and sexual intercourse, right? So what we did was we got together with the Sri Lanka Central Federation of Deaf, and we developed a sign language glossary to address this and introduced a new set of signs. This glossary is accessible in the UNFPA website, UNFPA Sri Lanka website, that you can access starting from virginity to starting from what sign language to indicate penis, vagina. We built the sign language, and then we mainstreamed it, attempted to mainstream it within the education system that we have for the deaf youth. And then again, we had consultations with the Sri Lanka Central Federation of Deaf, which is the main organization working with the deaf community in Sri Lanka, and improved on the signs as we went along. And we built a website called We Hear You that is meant to provide SRHR information and and also access to reference to services. So there again, it was a collaboration between the deaf community and the producers or the architects of the resource. The main thing is that it has to be centered around the people whom we are trying to help. And then it has to also operate on the principles of inclusivity and some things that we can bring into the table, like to make sure, like when we were working with deaf people, as you can, there were no information on gender. There were no information about sexual and reproductive health and rights, inclusivity. So these things, as we went along, we did technical sessions on trainings, give that gendered perspective, inclusion, everything. So yeah, so it was quite a learning curve for us as well, but I think we were successful in that sense because we involved the community actively.
Thank you so much, Shalani. From that, I really love that you're highlighting that everyone essentially needs to be on the same page and creating that bridge between the group who's going to be affected by the intervention and the group that is actually building the intervention. That's very important there. So let's go over to Manisha. Of course, it's not only those with hearing difficulties that might need additional consideration. So how can we design online spaces to give individuals the extra help that they might need? And how can we know what that extra help is and how to implement it?
Okay, so my very first recommendation, and this is based on my experience, is that we need to go for immersive qualitative research with our end users, people who really need help. And that means that we take our time, we hang out with them, we get into their lived contexts, and we have to be really faithful to our data and to our participants. And this also means that we don't do research for young people, but we also do research with young people about where exactly they need help and when they feel confident of, tackling the the online space. So I have just published a book called Gen Z, Digital Media and Transcultural Lives at Home in the World. And this is jointly authored with Dr. Kiran Bhatia. And we used exactly this approach for our book. And we were amazed to see that how many myths and how many of our assumptions this approach actually broke. So this kind of immersive qualitative research, along with similar immersive qualitative research online, and then combining these insights with the anonymous big data that is available on the net, if we combine all this insights, then I think it really helps us in designing spaces that people really care about. So I firmly believe that user experience research should not be only for increasing profit. I mean, there are, other larger benefits for that. Also, I think we need to remove our Western lens when we evaluate and propose, parameters or criteria for research as well as design. So our research has to, address diverse needs of young people in so many different situations. I think another helpful action would be to reducing and ultimately removing the dominance of English language on the net, because our research has shown us that young people really value when they can express, their stories in the languages that they are comfortable with, and they can seek information in the languages that they are comfortable with. But again, at the same time, if we want the internet to be a democratic space, we want it to be a space that contributes to a better world, a more peaceful world, then we also need to make sure that different people interact. There is dialogue, there are conversations, and for that, there are again, like powerful translation tools are also very welcome by young people. So both the ability to express in their own language and at the same time having translation tools that help them have conversation with others. I think both of these things are going to be very important. And finally, and we have said this again and again, but making the spaces safer. I mean, boys are equally vulnerable, but especially for girls, because girls everywhere in all situations online, have a very heightened vulnerability to abuse and, a lot of other different forms of violence against them. So we have to make sure that they can participate in these spaces, without self-censorship, without surveillance, and, without abuse. So if we can use research, to help these groups, I think we would do a good job. Thank you.
Thank you so
very,
much.
very much. My apologies. Go ahead.
You can go ahead, Liam.
Yeah, sure. Sorry, my apologies. I just wanted to jump in. You mentioned quite a few times about the idea of the internet being a democratic place and trying to remove a sort of Western lens to everything. So I think it'd be quite good to go to. I'm going to go to Joanna first. You work for UNICEF, a global, a truly global organization. What are some of the things that UNICEF are doing to, kind of broaden this all out?
Thank you, Liam. So I think some of the things that UNICEF is focused on in terms of addressing the issues you're talking about in relation to inclusion are focusing really on a number of things that Danielle and others have already brought up in strengthening and building digital literacy skills, access to digital learning platforms, and particularly with a focus among marginalized groups, focusing on online safety, also building capacity and implementing youth-centered design of digital health interventions. We have digital literacy campaigns and activities that aim to build skills, again, with a focus on those marginalized communities, and also a strong focus on girls' digital literacy skills in a number of countries and regions. We also have several initiatives within UNICEF, for example, something called Learning Passport that is expanding remote learning across different, particularly underserved, underconnected regions. Something called Internet of Good Things, which again is a platform that allows users to access information, especially around health, but other topics as well, whether you are or are not connected online. And then also GIGA, which is an initiative to connect all schools, to map and connect, infrastructurally all schools to internet. And all of these initiatives really are aimed at improving reach of those who are the least connected and underserved regions so that they can access quality information and also education. This particularly becomes important, these types of platforms, when any disruption happens, whether that's due to conflict, whether that's due to pandemic, whether that's due to climate-related disasters, and people are not able to access those in-person, school or other basic services. These digital platforms are important in those times. Also, to create safer digital environments, UNICEF works on a development of a number of different types of tools and guidelines and policies that focus on prioritizing and advocating for online safety and safeguarding of well-being for young online users. And of course, finally, as is the spirit with this webinar as well, working really closely with young people to develop those digital health interventions and policies that are responsive and centered around their needs is a really important part of our work as well.
And I imagine it's a very, very important part of the work that young experts, Tech for Health, are doing. At UNICEF, of course, this is one of the myriad of things you're doing, but young experts, this is very much, your specialization, young people in interaction technology. So Shalani, maybe you could just take us a few of the things that young experts, Tech for Health, are doing.
Yes. So just to give a context of what young experts Tech for Health, or YET for it for short, is, we are a network of young people with giving a focus on providing thought leadership for youth-centric digital health technologies, and providing youth-centered solutions in the transformation of healthcare into a digital space. So we do work with young people and youth-led and youth supporting organizations working on this same thing, by empowering them to have a more assertive stance on their respective spaces. So we work with around 12 organizations around the world working on digital health transformation and how young people can contribute to it. And also we have 5 research fellows, again, from different parts of the world, focusing their research on youth-centric solutions for digital health transformation. So quite an interesting, I'll just bring out few interesting projects and researchers. One thing that we've been focusing, one of our researcher fellows is focusing on how fintech can be used for digital health. We can actually make those knowledge products accessible, and it's accessible in the YET4H website for anyone who's curious to learn about it, and how SRHR, sexual and reproductive health and rights, and digital sector, what is the intersection between the two, and what have been the trends and patterns observed in the same was one other thing. Also, in terms of organizations, in the African region, we have Think Positive, Live Positive initiative, specifically focusing on the LGBTIQ plus community, and specifically young gay men and men who have sex with men, and how they can be included and inclusivity can be widened for them by improving their digital literacy and educating them on digital health technologies to get access, to get more inclusive access for healthcare. They have implemented different a wide variety of tools to do that. And we do have UR, which is an organization, a youth-led organization in Nepal, focusing on mental health and how access to mental health can be facilitated through digital platforms. So we've been seeing a variety of organizations, youth-led and youth-supporting, coming up with innovative solutions that can and does make a difference and can be used as best practices going forward. And Yet for Edge continues to also influence regional and global spaces and provide that space and speak out the necessity of having young people at the center of it all.
Amazing work being done by both UNICEF and Yet for Age. So now let's look at some of the advantages of the digital spaces when done right? Because I think we've acknowledged some of the negatives that could come across. So when concerns of inclusivity and access have been addressed, Eliza, could you take us through some of the outcomes for girls in quantums that have been positive, showing the advantages of the digital space? Okay, I think Eliza may have dropped off, so I'm just going to run to the next question then. Sherry, perhaps you could just outline for us what are some of the benefits that digital spaces can have on health, and if Eliza comes back on, oh, Eliza is back on. Okay, Yay. Great, Eliza. I'll just repeat the question quickly for you. No worries. The question is, what are some of the advantages of digital spaces when done right? Like, could you tell us some of the outcomes that you've seen with girls in quantum?
Yeah, for sure. Thank you, Danielle. So at Girls in Quantum, we've been so happy to start creating this community of young students, of adolescents, learning about each other as well, learning about technology and science, especially more girls in terms of addressing the gender gap. So we're really happy on that. We've been collaborating right now with several companies abroad, like IBM, for example, Perimeter Institute in Canada, and also we have been developing different programs. So just to tell you a little bit more, in March, we started a really great program with them, with some mentors from Waterloo University right there in Canada. And we started having this online program so students could learn about quantum computing, quantum mechanics, about more of science and research, how to do effective research among their peers. So that was actually a 3-month program, and it was great because someone that would have perhaps no knowledge or no previous knowledge on a certain technology, afterwards they develop a great research project. So it's just great to see this community growing. We have impacted more than 2,000 students from 21 countries so far. So it's just beautiful to see this collaboration among students, among peers, how we learn from each other, and also how we're from different countries. So right now we have ambassadors. They're from 14 countries as well, and that they belong to the general team. And we all start, for example, sharing our own opportunities in our countries. I'm from Latin America, I'm from Chile, and I share resources among my community, but also I see how other students are getting, not just in online sort of conferences or online programs to their regions, but also going to schools, organizing different games. We just started a great partnership with a researcher from Switzerland, and he told us, well, I'm creating this wonderful game to teach students about quantum computing or other technologies by playing a sort of game like Uno. So it's just so great to play cards and you can start learning about different topics. And I think that I'm so happy with what we have done, and hopefully we can start addressing this gender gap, also socioeconomic and linguistic sort of barriers that we now encounter through Girls in Quantum.
This is amazing. I think it's great to see young people self-organizing and then being supported by large firms to really get that impact at the community level. So let's go over to Sherry. Perhaps you could also share with us some of the benefits that digital spaces can have.
Absolutely. So in the public health and behavioral science literature, we have all kinds of interventions on topics like vaccination, HPV vaccine, substance abuse, sexual health, mental health, physical activity, nutrition. And online spaces gives us an opportunity to get those programs to youth. One of the biggest challenges in the work that we do in my field is implementation. So how do you get these programs to youth? I mean, we can do it in schools, we can do it through community organizations that are brick and mortar, but as we all know, youth are spending a lot of time online. And so we really need to think about how we can take some of that science and all of these evidence-based programs and reimagine them for online spaces. That's something that we're doing a lot in my lab, actually. In fact, we're kicking off a study looking at promoting HPV vaccine in sexual minority young women. So I think the opportunities are endless, and particularly with youth, because they do spend a lot of time on using social media in online spaces. And I also think that youth today have actually done a lot, even on their own, to improve health through online spaces. So I'll give you an example. I think this generation of youth have done more to dispel mental health stigma maybe than any other generation, precisely because of how they use social media to talk about their mental health. So that we have influencers, for example, on TikTok who talk about depression, having ADHD, Tourette syndrome, you name the mental health diagnosis, and there are influencers talking about it and dispelling myths about those disorders. Now, these are all happening in very public spaces. I think which I think has some, great benefits too, because it exposes a large population of people to that type of content. It can also bring in bullying and things like that. So I think there are also opportunities to create more private spaces, and that may actually invite more people to open up about whatever they're struggling with. I think online spaces around health really complement healthcare in ways that the needs of patients haven't been met before. And so what I mean by that is there is a desire for patients to connect with other people on their same journey, whether it's mental health or physical health. So whether you have diabetes, depression, you name it, there's a type of support and connection that you get from people on that same journey that's different than the support that you might get from other people in your life. It's very powerful. And so I think we need to think more about how we can create those online communities, take those evidence-based programs that we know and make them come to life in those communities. And in order to do this, I think we need lots of stakeholders at the tables. We need partnerships. I like that a big theme today so far has been kind of co-design, user-centered design, to figure out how to create these spaces in ways that would meet the needs of youth. I think we also need platforms, these social media platforms at the table, because not all platforms have features that are conducive to creating private communities. And so that's a stakeholder that I think needs to be in this conversation as well.
I think you've touched on so much, and I like that you've brought out this aspect of community. I think that that's what young people essentially are striving for in these online spaces. So as a follow-up question, we are here with the Lancet. So it's a medical research journal. So maybe, Sherry, before we open up to the audience for more questions, maybe you could take us through very quickly where you'd like to see research go in this area.
Great question. So the narrative that we see in the media about social media, I think we can all agree, is pretty negative. The headlines are all about the negative impacts on youth, and there certainly are negative impacts. But what we're not seeing enough, it's not, not creating exciting enough headlines, I guess, are the positive impacts. So I would like to see us talking more about these positive impacts, telling those stories in the media, and gathering more data about the positive impacts, because I think that negative narrative has also sort of infiltrated research. So a lot of studies are focused on the negative. So can we start focusing on the positive and how to create more positives? So are we studying how to deliver effective public health messaging or behavioral programs to youth on social media? Are we studying the positive impacts of youth influencers who are dispelling mental health stigma? Are we studying the positive impacts of being in a peer online health community? So more research in this area and more narratives in this area. I do think that digital spaces can be both positive or negative experiences. It just depends on the content that the individual is viewing, the nature of that community, et cetera. So I'll also say, I think we need a roadmap for parents and children on how they spend time in digital spaces in ways that add value to their life. So, when we, sometimes people ask me, is social media bad for youth health? And it's like, well, that's not a nuanced enough question, because how people spend their time online matters. There are things that you can be doing that can be very good for your health, and there can be things that you're doing that are very bad for your health. So I think we need to kind of get more nuanced in our questions that we're asking about the influence of social media on health, because social media is not one thing. There's all kinds of different things that we could be doing. Same with watching television or video games. It sort of depends. So we need more nuanced questions that we're asking so that we can sort of drill down and identify what are the positive uses, what are the negative uses, and how do we guide parents and communities around how to guide youth around how they're spending their time online. So that's kind of what I think really needs to be happening a lot more, so we can kind of change that narrative and be more nuanced in how we talk about how youth use online social media platforms.
All right, thank you so much, Sherry. I am now going to hand over to Liam to get us started with the Q&A section.
Yes, and it wouldn't be a Q&A about digital health if I didn't drop out moments before I need to speak, but I have returned and hopefully everyone can hear me. Thank you very much for all the questions. We're running maybe just a little bit behind time, so I might not be able to get to everyone, but I'll try and get to as many people as I can. So the first question I'm going to ask, this question's come up quite a few times. This specific one is from Mariana Ortran. I'm going to go to you, Shalani, first. It's important to mention, of course, the digital platforms. We do see incidences of sexual and, sexual violence and, other forms of violence, at the very least being kind of like promoted and encouraged by these online platforms. So how do we protect young people from them?
So I think it's first of all that it's very important to acknowledge these things. And I thank the audience for that question. Online gender-based violence and other forms of violence, technology-facilitated violence, specifically targeting youth and adolescents, are unfortunately prevalent in more ways than we can imagine. And the forms and the different ways of those, how it progresses, just improve, like it just phases and morphs into something new every day. That is where the importance of critical thinking and digital literacy comes in, and also specifically having a digital literacy component incorporated into a CSC, or comprehensive sexuality education model. So education system is where we can really influence, that is one in where we can influence young people and adolescents. But at the same time, we should also keep in mind that youth and adolescents are not just in a formal educational system. There are youth in and out of school, specifically in the region that I'm coming from, Sri Lanka. We have a big informal economy, and the AP, Asia Pacific region, specifically, there's a lot of out of school young people. So this is something that we need to think about on a policy level, to include digital literacy in our education system, so that young people know to critically think in making decisions when they use tools and digital resources online. That is really the most influential and the way that we would really make that difference, is what I feel. There are other short-term and immediate solutions that we do have, like having support systems, helplines, that could give them holistic support, technology related. Again, I can give you an example from Sri Lanka, where there's a hotline which is really a hotline plus an ecosystem of support where you get technical help if you are facing some sort of violence over any online media, and you can get referred to psychosocial support as well as legal support if need be. So we need to also look at that kind of solutions, but that's actually, you just address the result of the problem, but education and CSC is where you can really address the root of the problem.
Thank you very much. Does anyone else have anything they'd like to add? Or if not, I can move on to the next question. No, then there's a few questions for you, Joanna, about some of the UNICEF information you've spoken about. First of all, for those without digital access, how can they benefit from this Internet of Good Things?
Great. So I'm going to drop a link for people to go to the site, and it is a site, so they will need a device, whether that's computer or other kind of device to access it, but you don't need internet connection to access the information on there. And that's the technology side of it, where the information is accessible even without internet connection. So I'm happy to share with you, Liam, and then maybe you can share with others. And then they can also scroll through and see there's 4 languages that it's available. I believe Arabic, French, Spanish, English. And I can share that.
Yeah. Yes, and also just in general, is this work being published, perhaps in international medical journals? Where else can people find this stuff?
Some of the data points that we talked about from the report on child and youth access to internet, I can also share the link for the report that is published. And then in terms of the State of the World's Children report, there is a compendium report that's been published, and I'm happy to share that, that summarizes key points that young people have shared with us. But based on deeper analysis of those themes, there is a series of papers that have been developed, and it will be published in a journal supplement in May of 2024. And one of the papers on there, because of the topic of this webinar, it's specifically focused on digital communication and relationship with mental health. But I would really strongly recommend that, reading the series of papers, because as we mentioned, on and offline experiences are so woven together nowadays in terms of the impact on mental health. For example, there's one on family and caregivers, so they'll bring up, how online connectivity impacts those relationships as well. So that information will be accessible to everyone in May of 2024.
Thank you very much.
In the meantime,
Go ahead.
No, I was saying in the meantime, they can definitely read the compendium report. I'll also share the link. Thank you.
Cool. Thank you very much. We've had another question about an individual who's working with a particular community that didn't want to give their children access to the internet to preserve their innocence. However, in doing so, they're potentially limiting their health access for those children. So at what point should we respect a community's way of life, or let's say interfere with their culture on the grounds of improving access to health? Danielle, maybe you want to take this one.
Yeah, this is a very interesting topic because I sit on Jamaica's Digital Transformation Advisory Council. And, this is something we were looking at based on, different pockets of the island may have different, religious perspectives or just even social perspectives, generally speaking, that may make them say, we don't want to adopt the technology per se. So there are different categories of adopters. You're going to have those who are very excited, your first adopters who anything new comes up, they definitely want to be a part of it. You'll have those who will, kind of be normal or in the middle. They'll eventually adopt. And then you have those who are like, nope, not for me. Now, I think our approach has to be, how could technology potentially support this community within their specific context, right? As opposed to saying technology needs to be in every single community. The idea is looking at what are the specific needs for this community that they may be more, amenable to using technology for it. So it's not an idea where you're, forcing necessarily or interfering with anyone's culture. It's identifying for them specifically, how could technology support that specific context? And I also think, generally speaking, we just have to be very mindful of, picking up technology solutions from one part of the world or even one part of an island or a space and dropping it in another, expecting that it will work without looking at those specific cultural sensitivities.
Thank you. Does anyone have anything to add to that?
When we were researching for the book, there was something very interesting that we found that, we have this assumption that, local versus global, local as conservative, trying to preserve certain things, global as more emancipatory. But in people's lived realities, like it is all like intertwined and coming together. And we also found that a lot of young people want to retain many aspects of their local culture. So it's not like a blind rebellion against their local cultures and realities. And interestingly, all the young people who were participants in our research had designed their own individual personalized strategies, to negotiate that what part of local they want to keep, what part of global they want to assimilate, how, what they want to foreground, where, when, in what kind of spaces. So I think we should give them that freedom. And if we can design spaces where they can safely and freely interact with all different flows, I think they have that resilience to, design their own diet or the mix of cultures, I would say.
Cool. Thank you. Thank you very much. This question has come from a number of people, so I'm putting this to the whole group. We spoke a lot about inclusivity for those that already have access, those that are already able to access online spaces. But what about those in places without the infrastructure in place, without access to smartphones, without access to, Wi-Fi, whatever you want to name? What can we do, doing to actually get people online in the first place? It seems a very, very big divide. Would anyone like to speak about that? Shalani, maybe?
Yeah, so that again is one of the challenges that we do have in terms of getting access to digital technologies and spaces. That is a very real question. And the data on how digital technology or like the internet basically is accessible is also lacking in that way. There's no gender, age, community disaggregated data on use of the internet. But other than what we have on internet penetration level, I can, if anyone is more interested to read about it, you can simply visit the YetForH website. We have done investment case policy brief on the importance of investing more on digital health infrastructure. So one of the main things that we have addressed is the need for the governments to invest more on improving access to the to digital infrastructure by funding more on it. So that's not just something that is directed at the governments, it's also directed at private actors, CSOs who are working on these spaces to look at funding and improving digital infrastructure so that more and more people, young people, can access the digital space. And additionally, in a more regional and a global level, the discussions of digital transformation is becoming a little, it's becoming more mainstream. So for example, I'm currently in Bangkok participating in the Asia Pacific Population Conference, where digital transformation is one main topic that is discussed. Although it is still something that is not really like getting the recognition it deserves. It's something that has piqued the interest and caught the attention of those who are in the levels of those who are responsible for implementing these, implementing the policies that and the recommendations, programs of action ultimately. So I think the infrastructure question is something that all of us who as private actors and also state actors can really lobby for and take forward in improving and investing and calling for more funding at this point. So yeah.
So if I can just add, and I'm happy to share
Yes.
the link for more on Learning Passport. I think Sherlani brought up really good points. There are the initiatives which are trying to connect, and improve digital connectivity, but there are also those solutions that I've mentioned, for example, Learning Passport, that in the end of the day, what you're trying to do is that you're trying to enable continuous learning and access to education and information in either low to no connectivity areas. And what would that mean? If there's no connectivity, how are you accessing information? And that is creating, in Learning Passport, what it does is create what they call a hub device that stores, digital content, local content, and there's an ability for creating a local network where the students' devices can connect to this, and they can still access and consume information as if you're online and on internet. Obviously, that's in some cases even a solution. I think one member had talked about culture. If you know what's already accessible, it's almost like a version of using internet, but you know what kind of content is there. So it's not as wide as just everything on there, but it's the kind of information that's suitable and appropriate for the age and the students who are learning. So there is that kind of, I think, solutions between just internet access and no internet access. What about in between, if we're talking about connectivity that allows them to access the local information and things that we store on a device? So just mentioning, I think, yeah, according to the age category as well for the child, those are things that we can focus on.
Thank you very much for that addition. Would anyone else like to add anything to this question, or this answer, I suppose?
I would actually love to.
Yeah, sure.
That's great. So what I've been witnessed through Girls in Quantum and the community of students is that many times they do not have the access to internet connection. However, they try reaching their own local universities and local institutions so they can give them the right support to access internet. I think that has been crucial for them. And afterwards, they tell me all these experiences. And I think that's a really good sort of thing, that it's actually something that we can all do in terms of perhaps trying with other local organizations that can seek for help, or that you can seek for support, trying to reach out mentors. I think that collaborative aspect of it, it's really helpful. Or that's what I've been witnessing through other students that have been joining Girls in Quantum afterwards. So how they can reach organizations, in schools, institutions, and actually that's really effective. And I think that the way that students are trying to do that, to seek for learning opportunities, is just great, and an example that I would really like to share.
Cool. Thank you very, very much. I think, unfortunately, I'm going to have to call things there. We're already about 7 minutes over time. There have been a wealth of questions, and I'm very, very sorry to everyone that I couldn't get to. I think there's at least another webinar's worth of questions. So I'm just going to end very briefly, if you'll indulge me with some closing remarks, and then I'll let you all get off to enjoy your days. So yeah, I want to first of all thank you, everyone, all of our speakers, for taking part. And I just want to maybe, for those of us that are a bit older, this is focused on youth and adolescent health. I think, and by old, I just mean you remember a time before the internet. I think it can be tempting to view digital spaces as not quite real. The things that happen online aren't really as real as what happens outside those spaces. And I think it's also tempting to think that digital spaces, because they're kind of not real, they won't bring some of the failings of more, let's say, organic spaces. Discrimination, racism, exclusion, and inequality won't follow us there. And they maybe, if we are kind of naive about it, can be this sort of like top-down designed kind of fresh start, equal paradises. These, of course, are both false. For better or for worse, as I think a lot of our speakers have touched upon, there's no real way to separate the digital world from the rest of our existence. And the two will only become more entwined over the coming years and decades, especially, as kind of artificial intelligence pervades, all systems, be they healthcare or otherwise. And, as someone who's at times been tempted to fully separate myself from technology, I only just got Instagram. It's maybe tempting to think we can exclude ourselves, but as a lot of our speakers have spoken about, this is where children and adolescents are. So for those of us concerned with their health and well-being, these are spaces we need to be in as well. And as we've also seen from our speakers, the bias and prejudice that plague the rest of life are very, very much present, in what once was called cyberspace. So I think if I just have a few seconds to conclude, I think it's safe to say, digital spaces are very much here to stay. And we also can take forward some of the lessons and suggestions posited by our speakers to improving those spaces. I think the most common theme that's come out is that these spaces need to be co-designed with the young people, with the communities, with the vulnerable populations, whoever it is we're trying to help, with them in mind from the very beginning. We also need more research on the benefits and harms that digital spaces offer the young people. That sounded like my father there, the young people. And lastly, we need clearer guidance, again, youth-led guidance, on how to interact with these spaces, such that they improve rather than diminish the quality of life of the young people, and I guess everyone else using them. So thank you very much. I would just like to thank all of our panelists, and I will say goodbye to you all now, and thank you for coming along. Bye.